couple more things. I guess the last thing I'd want to ask you is, you've been in the belly of the beast as a diabetes educator, as someone who's worked in a hospital, as someone who's worked in his insurance, you know, coming across the whole healthcare industry, what are some of the key changes you want to see in diabetic health? I guess in any setting, like what are some key points you're looking to improve upon?
Definitely. just just gotta get those costs down, really. Um, and that's always, everybody points fingers at like whose fault it is, but it's always going to come down to the drug company, because if we can get those costs down, then the insurance companies will cover more stuff. So it's not necessarily, while I am very pro universal, like no private health insurance, it could work a bit better if the costs were lower, so that the insurance companies would be more likely to cover things because they're less expensive. um as well as then to like people really need to have access to educators and nurses and even health coaches. Like, I think I talk a lot of smack about health coaches, but I think they have their place and they're very important, especially when you're living with a chronic illness that affects your life 24/7. They can really help you problem solve through that. So that multidisciplinary approach and changing the way that we see clients in a clinic, instead of a 10-minute 20-minute visit with your doctor, being able to see them for a little bit longer and maybe see an educator afterwards, be able to see your podiatrist and your ophthalmologist in the same visit. There's actually a clinic in Atlanta that does that at Grady Hospital. So you get to see the doctor, the educator, you see a nurse, you see your podiatrist if you need to, and you see your case manager. And they're all there, which is great because
That's
that's what you need in diabetes. So,
because I'm thinking, even in my experience, when I've tried to see specialists, it's like they're always
yeah.
booking like 2 to 4 months out. So it's like, okay, I'll see my endocrinologist in March, then I'll see my
Mhm.
ophthalmologist in July. And like it just becomes this thing where they're not
Yeah.
coordinating. You're barely even getting to see the doctor when you do get to see him. That's an amazing way to just kind of have the whole thing in one spot.
Yes. It really takes, because that, like, it didn't like really occur to me that this would be an issue, but I see like a million specialists and I have to use my PTO. So like I don't go on vacation because I have to go to the doctor. So if we can get it kind of in one, obviously there's some other things we need to improve on, but I again would appreciate more of like that multi-specialty approach, and just uh, making it more accessible, and focus a little bit more on the specialists and the education in diabetes world.
That's awesome.